Welcome to day 8 of our boot camp series. My name is Amy Rich, and today's topic is return to work for healthcare providers and the work status report. If you've been following along with all the other boot camps, you might be a little tired by now. You've been making your way through the obstacle course. You made it over the climbing wall of information on workers' compensation, healthcare certified networks last time. You may need to head over to the recovery tent. And we mean recovery so that you can return to work with all of this workers' compensation knowledge and get your clinic off to a good start as far as workers' compensation. The learning objectives for today is know the benefits of recovering while on the job after an injury and reducing medically unnecessary time away from the job. Know how to complete and understand the work status report, and know the rule that addresses return to work and the form. Let's get started with our disclaimer, and that is this presentation is for your education, and we try to do our best to give you information about the workers' compensation system, but system participants like healthcare providers, employers, insurance carriers, even injured employees are responsible for knowing and complying with the applicable sections of our laws and our rules. So if there's ever a dispute about what we've said here or any kind of complaint or dispute, the rules are going to help resolve those disputes. So please understand your rules and your laws. That handout, the DWC Finding Resources, will help you find that information. And we provide citations throughout the bootcamp series in the slides. The overview for today's topic is we're going to cover the goals and legislative intent. When we say legislative intent, that is the Texas legislature writes the laws for Texas in workers' compensation. What did they intend for us to do with those laws? We write the rules that coincide with the act in the Texas Labor Code. So what are our goals as it relates to return to work? Then also medical literature and the support that it provides for early return to work and how it helps our injured employees. Treating doctors and other healthcare practitioners' roles in return to work. These are the people that have face time with our injured employees providing quality care. We want them to understand what their role is in returning or keeping an injured employee on the job while they're recovering after an injury. Also, the nuts and bolts about completing and billing a work status report. And also we'll talk about an optional report that the employers can fill out, the description of the injured employee's employment. That's the sister form to the 73. It's the DWC From-074. Those are the items that we will cover today. Let's start with the goals and legislative intent. The basic goal of the workers' compensation system in Texas is to help somebody, an injured employee, return to work as soon as it's considered safe and medically appropriate by their healthcare provider or practitioner, which is an individual healthcare provider providing quality care to our injured employees. We want to help remove all the barriers that may be perceived or real by the injured employee for them to make a decision to return to work. And everybody should be facilitating and helping that injured employee return to their lives and a productive role in the workplace. The intent is that the workers' compensation must encourage the safe and timely return to productive roles in the workplace and provide high-quality medical care that supports that restoration of their physical and psychological condition so that they can get back to their pre-injury earning capacity or an earning capacity that matches their skill set and their capabilities after an injury. Sometimes our injured employees have permanent impairment after an injury, but that doesn't mean they cannot work in some capacity. We have some regulatory structure around return to work in the Texas workers' compensation system, and that includes part of our goals is to provide high quality medical care to our injured employees. In the Texas workers' compensation system, we have treatment guidelines, both for network claims and for non-network claims. There are treatment guidelines in place. These are evidence-based medicine guidelines for high quality treatment. They're presumed to be medically necessary in our system. They are not black and white, but they are guidelines for our healthcare providers to follow as far as recommended treatment for their condition that they have after an injury. Also, there is return to work guidelines for the Texas system. These are commercially available products, both the treatment guidelines and the return to work guidelines. They're online subscriptions. They are not required for treating doctors to have, but they are the rules say they shall be followed. So it is a good idea for you to purchase these. But the return to work guidelines specifically give disability duration, and it's expressed in the amount of days. So I'm going to show you our return to work guideline and give you more information about that. There's also employer return to work programs. We provide education to employers across the state of Texas and encourage them to develop a return to work program for their employees so that they can reintegrate them back into the workplace as soon as it's medically safe and appropriate, because they hold the key to modified duty or to offer different jobs to that injured employee after an injury. So the employer has a very important part in clearing the way for an injured employee to come back to their lives and to a productive role in the workplace. And we have a return to work webpage that has a guide for employers to develop that return to work program. And lastly, case management. This is when perhaps an injured employee has surpassed the number of days that typically somebody recovers from injuries. They have specific injuries to specific job information, the return to work guidelines. So if your insurance carrier sees that someone is creeping past that and maybe has some delayed or failed recovery, they may assign a case manager to help facilitate the care that injured employee is receiving and facilitate and encourage return to work for that injured employee. So healthcare providers out there, please know that case management is a part of our system, and you may hear from case managers. Please work with them to help these injured employees get back to a productive life and to their role back at work, or to return to another type of job. Just depends on their situation. So case management is out there also. There are some charges that you can charge if you're a treating doctor or a referral doctor for case management, if you're participating in case management. And that would be in the chapter 137 and 134. Tricia is going to put something in the chat about that. Also, in the medical fee guideline, there's a frequently asked question, number 7, about case management charges and reimbursement. So know that we encourage case management in our system to help people get back to the workplace. Now, there's a lot of medical literature out there. There's articles that come across my desk all the time about how return to work or stay at work after an injury helps someone's recovery, helps them recover better and faster if they stay connected to the job. Some of the main organizations that help support this premise is the American College of Occupational and Environmental Medicine, or ACOM. Some of your doctors may be occupational doctors. They may be a member of ACOM. So there is a position statement there from ACOM that says sometimes a large number of people who, due to a medical condition that should normally result in only a few days of work absence, end up withdrawing from work either permanently or for a prolonged period. That's a key quote from the ACOM position statement. So most injuries in the state of Texas are temporary in nature, but even a strained sprain can spiral out of control if not handled appropriately by all system participants. That includes the treating doctor and the employer and the insurance carrier. So ACOM supports that. Also, the International Association of Industrial Accident Boards and Commissions has many position statements on early return to work and how it's beneficial for our injured employees to recover. The AMA has literature on return to work, American Academy of Orthopedic Surgeons, AAOS, and many more. So if you were just to Google return to work after or an industrial accident, you will see many articles about early return to work and how it benefits our injured employees. The articles talk about lots of benefits of working through recovery. The injured employees are going to recover faster if they're staying connected to their job, they're getting up, they're getting dressed, and they're going to work in some capacity or even part. They're going to recover faster than staying at home full time. Now, of course, I'm talking about people that are medically cleared to go back in some capacity. It has to be safe and appropriate, and the risk for injuring themselves or others has to be very minimal, if not any at all. And the healthcare provider is going to be making those decisions. Also, benefits of working after a work-related injury, it's going to help them prevent deconditioning. Like I said, getting up, getting dressed, and going somewhere and being a part of a group helps with the conditioning of that injured employee. So they can decondition pretty fast if they're staying at home and if there's no medical reason for them to be at home. So motion is lotion. The new sitting is the new smoking. So keep that in mind. We want to prevent deconditioning of our trained experienced employees. Also, there's a psychological and social impact to someone staying at home that doesn't have a medical reason, a true medical reason for staying home. It can cause more dysfunction in their lives, being isolated from their work group. So we want to minimize that dysfunction. Sometimes they had some pre-existing, maybe anxiety, depression. It can get worse if they're not connected and staying conditioned in their lives. Also, job skills. I know at my work, things change all the time. I can think of a manufacturing job, things will change all the time. So how are they going to retain their job skills if they're at home for medically unnecessary lost time? So we want them to retain those job skills, even if they're coming to work in a part-time basis or a limited basis, they're going to stay connected. Also, they may be able to keep their job. In the Texas workers' compensation system, an employer may not retaliate against an injured employee. That means fire them just because they got injured on the job. However, if someone is not able to fulfill their job duties and following their human resource policies on absenteeism, they may need to fill that job. So it doesn't mean they can't lose their job, it just means they cannot be fired in retaliation for having an injury. So the sooner they get back to the workplace in some sort of capacity, the more likely they will keep their job. The consequences of medically unnecessary lost time can be significant for an injured employee. They're going to be in poor mental and physical health with their social isolation at home. In the workers' compensation system, there are wage replacement benefits for an injured employee, but it is not 100% of their wage. It's going to be a percent. In fact, temporary income benefits is 70% of their average weekly wage. That's going to cause financial hardship on top of someone that's trying to recover from a physical or a psychological injury. So add that layer of stress on somebody, they're going to recover slower. So the answer is to have a return to work program or stay at work after an injury to reduce that financial hardship on someone. It can cause financial issues and family issues. Think, if there's difficulty in somebody recovering, they could have fights at home, divorce, people have to drop out of school, maybe they can't pay their rent or their mortgage. Those are significant barriers to their recovery and returning to the workplace. The social isolation, I think all of us can relate to how that hurts us. During the pandemic, it was very difficult for people when they had social isolation end on a days on end. So keep that in mind. We all can have empathy for that and how it plays a role in increase in anxiety, depression. Staying connected and being part of a group is important. So we don't want them to lose connection to the employer. They can also lose job-related benefits. So if they're not receiving wages, then they stop paying into Social Security benefits, perhaps. Maybe they start to use up their sick time. Maybe they're not paying into Social Security or Medicare. Those are, or 401k for that matter, they're going to lose those benefits the longer they're at home. And obviously, they could lose their job ultimately. So those are consequences. And look at the title. It's medically unnecessary lost time. I want to make that point. Some injured employees need that rest and recovery away from work, but it is the healthcare practitioner in conjunction with working with that injured employee to make decisions on what they can and can't do safely back in the workplace. The treating doctor and other healthcare practitioners' role in return to work. We believe at the Workers' Compensation Division that it is a shared responsibility for removing barriers and encouraging somebody to come back to work. I'm going to show you our return to work page now on our website so that you can see a graphic of that. Here's our web page. If you click on the Workers' Comp tab on the right, that's our website. I don't want you to go to these topics A through Z. Go to these topics A through Z here. This is workers' comp centric. You'll see that on your finding resources. If you go to R for return to work, this is our return. That return to work is a shared responsibility, and it has every system participant in here. We have the injured employee up here. But for employers, we have the guide, and we have another video for you. Healthcare providers, we've got that position page, issue paper published by the IABC that I talked about. Here's one piece of literature your healthcare practitioner can read about return to work. There's other information rules and the forms here for healthcare providers. Insurance carriers have information also down here. And also our responsibility as a division, like what we're doing today, and that is to teach you about return to work. You'll see every entity or each system participant has responsibilities for return to work. We're going to be going over the healthcare practitioner's responsibilities, but I want to make sure you understand this. The employer, if there are employers listening out there, you are the only system participant that can make job offers to that injured employee once you get the information on what they can and can't do safely. The healthcare practitioner cannot do that. So this is a handoff between the healthcare provider and the employer. And the insurance carrier also, processes claims and benefits. And we down here at the Division of Workers' Compensation provide the structure and education, all supporting the injured employee up here to go back to work as soon as it's medically safe and appropriate. So that is a graphical illustration of how we see return to work as a shared responsibility. So let's go into the treating doctor's role. Mainly, the first thing is to establish return to work or stay at work expectations or goals with the injured employee beginning during the first visit. This should not be talked about on the 10th visit, say. Let's talk about you returning to work. This should be something where you're developing expectations with the injured employee and talking about it. Doesn't mean they have to go back to work that day or the next day. This is where your MD guidelines come into play, where you can look at the duration disability and set those expectations for how long you think they might be in pain, how long it might be before they can return to work in some sort of capacity. Again, it doesn't mean you're rushing somebody back to work. It means that it's important to measure that health outcome. So return to work should be one of those health outcomes that you measure for your medical interventions. Are my medical interventions working so that they can, get around and walk and they're mobile? Return to work should be one of those outcomes that you measure. So talk about return to work as part of a normal exam for an injured employee. This should be setting expectations. So the first visit and discuss often. You're also going to be communicating regularly with referral and ancillary providers. So if I'm the treating doctor and I've sent my injured employee to an orthopedist or a physical therapist, that kind of communication should be going on all the time. You two should be on the same page as far as return to work expectations and what that injured employee can and can't do safely. So, treating doctor, you're ultimately responsible for the care and coordination, the coordination of care for that injured employee. Make sure you're staying in touch like you should be just for their health care, but about return to work specifically. Also, incorporate returning to work into your treatment plan. So just as you take out that prescription for PT, that prescription for medicines, it should be return to work also should be incorporated into that injured employee's treatment plan. And use the division's return to work guideline, which is called the MD guidelines for non-network, to look at those disability duration information and values. Also know that for networks, so if you're working with a network claimant, look at your contract to see what return to work guideline they use or they want you to use. You have to use one. So for networks, they get to choose their own. For non-networks, it is the MD guidelines. Again, this is a commercially available product. It does cost money to have a subscription. The rules say that you shall use the return to work guidelines for evaluation of expected and the average return to work timeframes. You can find the MD guidelines at this webpage or call that number to find out about purchasing it. You do not have to purchase it unless you're a designated doctor, but it is like operating in the dark when you don't have what we consider scientifically valid evidence-based medicine. I'm going to jump over to the MD guidelines right now and show you what it looks like. I'm already signed in as a user. This is what it looks like. MD guidelines. This is my dashboard. And each of the guidelines, the ODG and the MDG, have both return to work and treatment guidelines. In the non-network side of workers' compensation, the ODG is used for treatment guidelines, and the MD guidelines are used for return to work guidelines. So this one that you're looking at is for return to work duration views only. They do have the treatment guidelines right under here under DART, but we're asking you it is required by the rules for the duration views only. And this can be customized to your injured employee, and let me show you how. So if I'm a doctor working with a patient that has low back pain, which is a very common symptom that our injured employees experience, and we happen to know that this patient happens to be a truck driver. So it's going to give you information about truck drivers. I'm going to choose heavy tractor trailer truck drivers. This is job title database is very large. You can search for any job title and the injured employee can give you that title. And it also assigns a job class. So this is a medium physical job. They go from light, medium, heavy to very heavy. You can go to the Job Title Explorer here if you want to search for job titles here. But once you connect this with the type of job, there are basically 4 views here. The physiological view will show duration in days, minimum, optimum, and maximum. So if I had a sedentary job and had low back pain, there probably is no cause for time away from work. So 0, 0, and a max of 7 days. Again, these are not black and white. They are averages based on a large population of data that this group has. So this one's medium. So you'll look that it's highlighted for this combination of low back pain for a heavy and tractor, trailer, truck drivers. Now look at the population view. Again, they have a huge database of people that have had this combination. So it shows duration of days. You've got outliers, of course. And then you have averages. Also the case view. For those patients that don't fit the mold, they have comorbidities, maybe they have pre-existing conditions, you can code in here those comorbid conditions for that injured employee to take into account, and the days adjust if you do that. So if your person has liver disease, tumors, or CHF, arrhythmia, other things that play into their recovery, you can plug this in. Their age sometimes changes the duration of days. So you can do this with MD guidelines, and then there's summary information here. So this is a tool for healthcare providers, insurance carriers, and this could be used to talk to your injured employees about the average amount of times and set those expectations on the first visit and on from there, especially if you're working with a case manager. So back to the presentation. That's MD guidelines. Again, it's used for non-network. It may be used for your network claimants. Check your contract. I don't know what the contract says, so keep that in mind. And if you want to contact MD guidelines to get this subscription, you can go to D for disability management on our website, or here's a number and the email hyperlink, excuse me, the URL for their website. In the treating doctor's role, you need to be aware that there could be factors, like I was talking about earlier, factors that are non-medical that may interfere with successful treatment and return to work. I know that treating doctors can't control all the things that are going on with this injured employee, but being aware of that, this is a whole person you're treating. It's just not their job title. This is a whole person. So be aware of those non-medical factors that may interfere with successful treatment and return to work. And if you can help in that area, do so. Maybe there's social issues like they can't get a ride, or there's other things going on at home. Be aware that those things may interfere and cause delayed and failed recovery. Also encourage the injured employee to take an active role. Sometimes if they're on the passive side, they don't realize that they can communicate with you and tell you what they think they can and can't do back at the workplace. Take an active role in their recovery. That empowerment helps them understand if they make a decision to go back to work, you will do everything in your power to help them get there. Explain that pain, because we all have pain, and at one time in our life, lots of people experience pain. Explain that pain doesn't always mean they can't be active or working. I know back in the day, if somebody got a back injury, say in my dad's generation, people would go and lay down for long periods of times, and that made it worse. So movement in a measured, progressive way is good for our injured employees to stay active and get back to their lives. So your job as a healthcare practitioner or treating doctor is to assess those injured employees' abilities in relation to functions and tasks, not just truck driver. What else can they do? Can they sit at a desk? Can they sort papers? Can they train somebody else instead of the driving? Think about the functions and duties, not just can they be a truck driver from this day forward. So break it down so that you can help give the employer information about what they can do, and the employer can make decisions about modified duty. So identify and focus on what they can do. Stay positive with the injured employee. We want to talk about what they can do almost as much or more than what they can't do. Talk to the employer. It's important. I have talked to employers across the state of Texas, and I say, if you have any questions about what your injured employee or just your employee, you want to just call them your employee, your trained, experienced employee, what can they do back at the workplace? You can talk to the employers if you're a doctor. That helps bridge the gap between what the injured employee is telling you, what the employer has available, that sort of thing. And what we don't want you to do is do not take someone off of work just because they can't perform the exact job that they had, or that you hear from the injured employee that the employer is not willing to offer a modified duty. Your job is to tell us what they can and can't do safely, and then let the employer take the next step in offering that employment opportunity for the injured employee. So you're going to specify what they can and can't do on the, what the restrictions are on the DWC Form 73, which is the work status report. There is also maybe some misconceptions around maximum medical improvement, or MMI. This is a date that the treating doctor assigns to an injured employee saying, this is as good as the injured employee is going to get. There's no further material recovery. There are misconceptions that you can't release them back to some sort of duty before reaching MMI. That is a mistake. Remember, they can recover and get better while they're still on the job. So don't let the date of MMI impact how you fill out the 73 form. You can release somebody back to work before MMI. And even if they reach MMI, they may be able to go back to work with some restrictions, or they may not be able to go back to work even when they reach MMI. So misconceptions on either side of that date. Remember, your job as a doctor is to decide what they can and can't do physically. If you need to work with the physical therapist and talk to them about that, or the referral doctor, you can talk to them about that and get on the same page there, because you don't want competing DWC 73s. Then the injured employee is going to be confused. So make sure you're talking with them. And release the injured employee to work as soon as it's medically appropriate. And the employer takes the baton from there and makes the employment decisions. If the employer doesn't have exactly the same job or only has part-time, remember, this is not going to impact their eligibility for income benefits. The temporary income benefits are going to be fluctuating depending on how much they're earning. So if they're going back to work part-time and only earning half of their average weekly wage, the TIBs, or temporary income benefits, are going to be flexed up or down depending. They're going to be entitled to TIBs to compensate for lost wages until they reach MMI. And after they reach MMI, there could be other benefits they're entitled to. That's how the system works. I've talked about this several times, but collaboration between the treating doctor and the injured employee on establishing return to work goals. So a little bit of responsibility on the ancillary providers and the referral doctors, the orthopedists, the neurologists, surgeons, working with the treating doctor. The physical therapist has a responsibility to collaborate with the treating doctor on the return to work goals. Think of this: the physical therapist has so much time with the injured employee on what they can and can't do. This is a great time to help your physical therapist or occupational therapist know that if they focus on the positive and explain to the injured employee that they're going to get better faster if they go back to work in some sort of capacity as soon as it's medically safe and appropriate. So you're going to coordinate the injured employee's healthcare and work status with that treating doctor. The referral doctor does have a responsibility to submit the 73 too, as long as it's required by rule. And we're going to go over that in just a moment. And that is completing and billing for the DWC Form 73, which is also known as the Work Status Report. It is a communication tool. Yes, you're going to be documenting what they can and can't do safely, but it also is something that you can put in front of the patient and guide a discussion about what they can and can't do. That form also goes to the carrier and it goes to the employer and needs to be understood by all parties. So does the injured employee understand what you're writing on that Form 73? Not just throw the 73 at them and walk away. This is a discussion. It's a communication tool for all system participants to understand what the injured employee can do, what's their functional ability, and whether they have to go back to work with restrictions or without restrictions, or if they cannot go back to work at all. That's what the Form 73 is about. So when is it required and when is it submitted? Well, it's submitted when it's required on the very first visit. So like I said, establishing early return to work goals is important on the very first visit, unless it's the emergency room. If you're a doctor, treating doctor, or a referral doctor is seeing the patient for the first time for that injury, you need to fill one out. you need to fill out a DWC 73. And that includes if a delegated physician assistant or advanced practice registered nurse is seeing for the first time, they need to fill the work status report. They are allowed to fill this out and complete it if they're the ones seeing the patient on the first visit. So after that, anytime activity restrictions change substantially, or maybe they can go back to work on a part-time basis from being unable to work. Now they can work part-time. So if anything changes in their abilities, their functional abilities, or their work status, you need to complete another 73. And sometimes the insurance carrier wants a 73, and they can request that, and you can fill it out, but it must be based on scheduled appointments. So it has to be associated with an exam, but it must be based on scheduled appointments with the injured employees and not more than once every 2 weeks. So if the insurance carrier is requesting it, use these conditions for when you complete one. Notice on this slide, it does not say every visit requires a 73. Now that may be the case if things keep changing, but I doubt it. So first visit, when anything changes and upon request of the insurance carrier, that is when the rule requires it, and that is when you can bill for it. Let's go over specifically what does a change of work status means. That means one of three things. It allows the injured employee to return to work without restrictions. It's not the same thing as MMI. That's one work status. The next work status is then go back to work with some restrictions. Maybe it's part-time, maybe it's only sitting, maybe it's only standing and no climbing or no running, just depends. And then the last work status is it prevents an injured employee from returning to work at all. So those are changes in work status. Substantial change in activity restrictions means that from the last 73, maybe they were only able to lift 10 pounds. Now they can lift 20 pounds. So it prevents them from working, or maybe they got worse from the last 73. So anything that changes there, either they have more restrictions or less restrictions, maybe they have an expanded ability to function, then you're going to do complete another 73. So that's substantial change in activity restrictions. That justifies and requires another 73. So who gets this form? We talked about that earlier, but the injured employee gets that form at the time of the examination. If you happen to be doing telemedicine, you're going to electronically deliver that to the injured employee. And again, it's not just hand it over and let them figure it out later. This should be a discussion with the injured employee, empowering them to say and participate in that discussion and the determination of those abilities. The employer gets the form not later than the end of the second working day after the exam. So you can send it to them electronically, but the most important thing is they have to understand what it is saying. This is the form that keeps the wheels of workers' compensation going. It also goes to the insurance carrier. Again, not later than the end of the second working day, not calendar day, working day after the date of examination. You can send that by electronic transmission also. Now we're going to go over the form and what it looks like in those sections. So this is the top of your work status report. This is the DWC 73. Most of our forms on our website under F for forms will have instructions on the second page. So if you've printed out just the first page and you want to see the instructions, you can always go to F for forms and see the whole form plus the instructions. Now in part 1, this is where you put demographic information about your injured employee and who is filling this out. Also in box 4, this is the injured employee's description of what happened. What is the incident that happened that created this injury? So that's their words you're putting in there. In section 2, work status information, this is where you're going to make selections into those 3 different work statuses. So 13A is your injured employee can go back to work without restrictions as of this date. Or B, they can return with restrictions between this date and this date. Or C, they cannot return to work as of this day through this day. And then don't ignore the very bottom section. This is where you're going to put a description of how the injury prevents somebody from doing anything back at the workplace. So this is a very important slot. If you're checking 13C, pay attention. This needs to be filled out by the clinician. This is an example of an employee that can work with restrictions. So they check 13B. And further down the form, they're going to tell us what those activity restrictions are. So the max number of hours for postural restrictions, you're going to say how many hours, motion restrictions, miscellaneous restrictions, lift and carry, and what it's restricted to if it's a certain body part. And then also in 16, if there's any other communication about what you think this person shouldn't be doing, you put it in there, and that's a free text form, box for you. And then, of course, the medications. So this is the specific activity restrictions your clinician should be filling out and discussing with the employer and the injured employee so they can take the baton and make their decisions going forward about what they can offer to that injured employee. If the injured employee is unable to work at all, 13C will be checked, and then the explanation will be put in that section. It needs to tell us why medically that injured employee can't return to work. Things like, well, the employer doesn't have a job for them is not a medical reason. We have heard that the medically unnecessary time can be as high as 60 to 80% of the time away from work is not due to a medical reason. So we want to identify those and remove those barriers for somebody returning to work. So if you're checking 13C, it should be a medical reason or a psychological reason. We have injured employees that have psychological injuries and trauma. Tell us why they can't return to the workplace in any capacity. If you're just putting pain in here, that's not a sufficient explanation. It may be the thing that's preventing them, but you need to tell us more why they can't do anything back at the workplace. This is important. We do monitor this in our system. So if you're checking 13C, please explain with a sufficient explanation of why they can't do place. And the last section is you're going to talk about follow-up. Are they coming back for more appointments? This helps the employer know that information and coordinate with the injured employee when they have to go back for more appointments. Maybe they have a referral or consult on the books. Maybe they're receiving physical therapy. We need to put that in the expected follow-up services includes. And then special attention to the last box there, none. This is where you can communicate to the insurance carrier that this is the last scheduled visit for this problem. At this time, no further medical care is anticipated. Some of you may receive calls asking for the 69, which is the medical report of medical evaluation, because the carrier is looking for information about, is this the last scheduled visit? If you use this section, you could send the 73 and inform the carrier with the last office visit to help them understand what you predict is the follow-up and expected follow-up services for that injured employee. And then all the signatures of who is filling out the form and what role they are playing. In this case, it is an advanced practice registered nurse that filed this form and completed this form. Again, if they're properly delegated by the treating doctor, they can fill out the form. The PAs and APRNs can do that. Billing for a work status report. Rule 129.5 is the work status report rule. And it's going to go over it addresses all the things that I've gone over so far. And it tells you when you can bill and how you can bill for the work status report. Remember, it's on the first visit, anything changes, and when the insurance carrier requests it. Then you can bill for a work status report and bill using the CPT code 99080-73 for the modifier, $15. And the insurance carriers reimbursement is only due if you're following the rules. So if you're billing a 73 on every single visit that may or may not be required by the rule, you have to follow the rule for it to be justified for reimbursement. One other form I want to tell you about. So if you're a treating doctor talking to an injured employee, you're trying to determine what they can and can't do safely back at their job site. And you've got an injured employee in front of you that may or may not remember things because they just got injured, right? An employer can fill out a DWC 74 and help explain the tasks and duties associated with this injured employee's job. It is not required for the employer to fill this out, but we do educate the employers across Texas that it is out there for them to have ready to send with the injured employee when they go get treatment, or they can send it later. As long as the healthcare practitioner can see this form, it helps him or her make better decisions about what the injured employee can and can't do as far as their job functions, duties, what specific tasks can they do, what work activities, and physical responsibility. So this is a form, and it is the sister form to the 73. If you notice here, it looks very similar to the 73. So apples to apples for that healthcare practitioner. That injured employee can be providing this to the doctor, or the employer can send it over, or the healthcare practitioner can call the employer and say, hey, there's a form 74. Do you mind filling it out? That will really help me. Do they have to? No, but do we encourage them to do that? Yes, we do. So the form 74 is out there for your use too. So if you're a healthcare provider and you know that your injured employee, there's been some changes in their functional ability. Maybe they have permanent impairment, or maybe you know that they did lose their job. There is the Texas Workforce Commission that offers free vocational rehab services to our injured employees of Texas to help them prepare for, obtain, and get another job that does match their abilities. So you can refer your injured employees over to the vocational rehab section of the Texas Workforce Commission. They'll be happy to work with your injured employee about getting back to some sort of job that will help their health in general. Now, we at the Division of Workers' Compensation, there are certain types of injuries, or any injured employee that's been off work 12 weeks or more. We do send that list of injured employees over to the Texas Workforce Commission to reach out and help those injured employees. The injured employees can self-refer also, even if they haven't been off work for 12 weeks, or they don't have those specific diagnoses or conditions. Anybody can use the Texas Workforce Commission vocational rehab services for eligible adults with disabilities to help them get back into the workforce. So it's a good tool to know about and to help your injured employees. There are studies out there that show if an injured employee has been off work for 12 weeks, their possibility of ever returning to the workforce drops dramatically. So that's why we are trying to educate healthcare practitioners, employers, and injured employees that the sooner they get back to the work, the better and faster they're going to heal, as long as it's within the restrictions that the doctor identifies. To review what we've talked about today, we talked about the goals of the Texas Workers' Compensation System, the legislative intent for return to work, the medical literature that's out there supporting return to work and stay at work after an injury, what the role is for our healthcare practitioners, our treating doctors, the mid-level practitioners, and the referral doctors, and completing the work status report, the 73, and the description of the injured employee's employment, the 74, which is filled out by the employer. It is not required, remember, but it is helpful to put apples to apples together. Now, we're going to flex the knowledge, hopefully, that you've gained from this workout in the recovery tent, the return to work tent, if you will. We hopefully have trained your brain. I'm going to go over each of the polling questions now. Question number 1, return to work discussions should be early and often to minimize the bartering between the injured employee and the treating doctor later, so there is less surprise and potential conflict. The answer is true. This should be talked about on the very first visit and often, using the 73 as a communication tool. Question number 2, the treating doctor should communicate regularly with referral and ancillary healthcare providers about the injured employee's care and return to work expectations. That is true, and most of you got it right. Congratulations. Number 3, treating doctors should talk to the employer about options for restricted or modified work assignments to assist the injured employee's recovery, and that is true. They should talk to them, especially if the employer is calling to ask questions about the 73. Number 4, when is a DWC 73 form submitted? On the initial visit, when the activity restrictions substantially change or work status changes, and at the request of the insurance carrier, and all of the above is the correct answer. All of the above. Correct. Number 5, it is important for the healthcare practitioner to explain why the injured employee is prevented from returning to work in box 13C. The answer is yes, and all of you got that correct. Thank you so much for participating in these questions. Thank you so much for attending this last boot camp session.